Time now for our morning rounds, our look at the medical news of the week. According to the American Cancer Society, nearly 29,000 men will die this year from prostate cancer.
This week, updated screening guidelines for prostate cancer were published in the Journal of the American Medical Association with some notable changes from previous editions. Here to discuss some of the updates is CBS News medical contributor Dr. David Agus, who joins us bright and early from Los Angeles. David, thanks for getting up so early this morning.
I am up, Anthony.
Let's talk. What are some of the most prominent changes here, David?
Well, in 2012, the U.S. Preventive Task Force said nobody should be screened for PSA testing. The data didn't merit it. And now, in studying Europe with longer follow-up, is showing clear survival to the people who were tested. And so they changed the recommendations so that people aged 55 to 69 now should talk to their doctor. So it's a discussion with your doctor about whether you should be tested or not based on your own value system. The problem is there's some false positives. So not everybody should be tested, but the discussion should happen 55 to age 69.
David, Dr. Agus, the New England Journal also found this week in that same topic, they released a study that looked at the use of MRIs for that screening. What did it find?
It's so cool, right? Wednesday, the U.S. Preventive Task Force said we have a problem with biopsies, too many false positives, but we have to do it because it saves some lives. The next day, the New England Journal of Medicine has an article about a better way to do biopsies, showing that if you do an MRI and know where to stick the needle, you get fewer false positives, you find the more aggressive cancers, and fewer people need biopsies. So an advance happened the next day. Pretty exciting.
David, these false positives are really scary. I had one. I mean, there's nothing more terrifying. Is it really possible to have a test that's essentially foolproof for this?
Not even close. You know, what we know is that since we started screening, the death rate has died of prostate cancer. So I'm a believer in screening. People say, have you been tested? And I say, yes, I am tested. But, I feel for what you went through. A false positive is a scary thing, but also getting an aggressive prostate cancer that has left the prostate is also very scary.
All right, our next topic, a form of injury that impacts older Americans at an alarming rate. It's falling. A new report from the CDC is bringing more attention to the issue.
In fact, 1 in 4 Americans aged 65 and older report falling every year. This accounts for the largest percentage of unintentional deaths. Moreover, there are roughly 3 million fall-related emergency room visits annually. Dr. Agus, when you hear those numbers, I guess what can you tell us about why this keeps happening? Why there's been this increase?
It's a staggering amount of statistics, right? 18,000 deaths in 2007, close to 30,000 deaths in 2016. So people are getting older. They're on more medicines, and the medicines can interact, make it harder to walk, especially at night when you go up and go to the bathroom. They're on more blood thinners. And at the same time, we need to counsel patients better because this is a preventable cause of death. But those statistics, the death rate rising 3% or so a year, is really worrisome.
David, are there specific risk factors that you can look at that indicate it's more likely for this to happen to somebody?
No question about it. So multiple medicines, being on a blood thinner, for example, if you have atrial fibrillation or an irregular heartbeat on a blood thinner, you hit your head, you can get a bleed. People who urinate a lot at night is a risk factor. You get up at night, you're a little bit disoriented, it's dark, you can trip. And people who have a difficulty in gait. So as a doctor, I have to say, do you have any trouble walking? And I have to assess their stability and also look at the medicines they're on and try to counsel them so that I can try to prevent a fall.
And finally, Dr. Agus, we get an assist from the technology area. Simple activities like eating and getting dressed are something most people don't think about. But for those who have dementia, it can be a real struggle.
Researchers at NYU, Arizona State, and the MGH Institute of Health Professions recently unveiled a self-dressing system assisted by smart technology for tracking, guidance, and recognition. It's designed to allow people with dementia to get dressed on their own. Each item of clothing has barcoded information that verifies that the garment has been put on correctly. A caregiver can start and monitor the system using an app. The system, known as Dress, is in the prototype stage, but developers caution more tweaks are needed before it heads to the market. Still, David, that's incredibly encouraging.
It's great. I mean, it's very hard for caregivers to dress, especially when you're of different sexes. And so this is something that will ease some of their fears, and the technology is exciting. The data in this study were, really impressive and need a little bit of improvement, but this is something that's going to help a lot of people.
Dr. David Agus, thank you so much for joining us this morning.
Thank you, guys.